Well, herpes is a viral infection or a virus that can infect both men and women. There are two different types of herpes. There's the type 1, which we generally think of as cold sores, and the type 2, which is genital herpes, or the more classically associated as being a sexually transmitted disease. It's been estimated that between 45 and 60 million Americans are infected with genital herpes, which is roughly 1 in 5 adult Americans. The CDC thinks that about 1 million Americans get infected every year with genital herpes.
At least 60% of the population in the United States will test positive for antibodies to herpes type 1, and 30 to 50% will show positive for herpes type 2.
A significant number of people, it's estimated, have no idea that they actually have ever been infected with the virus. They may have had a very minimal initial outbreak, and then just think every now and then they get a little itching, burning, and not even realize that they have the virus at all.
It's generally accepted by most people that that's the only time you have to worry is when you're having an outbreak. But that's not true. Medical science has proven as far back as 1985 that people could get the disease from a person who didn't know they had it, have the disease themselves without knowing they had it, and pass it on to someone else who got the disease from them without anyone knowing anybody had anything. One of the problems we've had until the last 3 or 4 years has been that the testing for antibodies was not as accurate as it is now, thanks to newer tests which have only been available for the last 3 or 4 years. As a result, a lot of people had herpes without knowing it.
When someone first gets what we refer to as a primary outbreak, or their first outbreak of genital herpes, they quite frequently will have the feeling like they're coming down with the flu. They may run a fever and then get this pain, stinging, blisters, and then the ulcers in the genital area.
Symptoms are an irritation in the area where the herpes is going to break out, a feeling of tingling or maybe some redness, which turns into a little blister type thing or a cluster of blisters, and the blisters break, forming open sores which heal over time. The incubation period has traditionally been set at 3 to 20 days, which is a little different from other viral diseases in the same category, where the disease breaks out 14 days after you're exposed.
For some people, it may be a very mild to non-noticeable infection. As I said, other people may actually have serious flu-like symptoms, and on occasions we sometimes have to admit women into the hospital because of the extensive nature of the outbreak.
Because some people who have the virus in an asymptomatic state don't know it, and they may give it to somebody who, instead of being asymptomatic, goes ahead and breaks out. And that's where the problems come, and you get all the recriminations of someone who basically tells their partner, I've never had herpes. All of a sudden the partner comes up with herpes, and now they think there's been some infidelity there when maybe there hasn't been.
Basically, the virus kind of goes into a bloom, just like certainly sometimes people with allergies notice that their allergies are flaring because the pollen is higher in the air. You don't notice any more flowers on the trees so much, it's just they're shedding their pollen. And similarly, the virus goes into a bloom and sheds itself from areas like the cervix or other tissues that have been infected, and so the bloom is there, the pollen is there, so to speak, and available to then attack somebody else.
It's not possible to be sure that it's a safe time, because the virus can be present, and the only way to know whether it's present or not would be to do a culture of the area where a person has outbreaks and find out if the herpes virus was there. But by the time you get the culture report back, it doesn't really matter.
Basically, the treatments break down to either pills or creams of antiviral agents. The most classically are the acyclovir or Zovirax, the famvir or famciclovir, or the valacyclovir Valtrex. Well, there are two different ways that you can take the medications. First, for the primary outbreak or for recurrent outbreaks, you begin the medication, and it has been shown to shorten the duration and decrease the severity of the outbreak itself. It's not going to immediately clean it up, but it will kind of lessen the severity. The other approach is to do it as suppressive therapy, where you actually take the medication on a daily basis to decrease the chance of an outbreak happening.
There are studies available that show that the Zovirax, Valtrex, and Famvir do shorten the time during which the virus is being shed in an outbreak, and it cuts down the time for healing completely. And if a person takes the drug on a suppressive basis to suppress outbreaks, they can actually cut down the chances of having asymptomatic viral shedding by as much as 75%.
A significant percentage of patients actually do improve with the antiviral therapy, especially in terms of the suppressive therapy, which has been shown to decrease the frequency of recurrences, which is probably one of the better ways to use the medications for someone who has more than a couple of outbreaks a year. Because the medication itself, as I mentioned, doesn't suddenly shut the outbreak off. It just decreases the duration and shortens the duration and decreases the intensity. So instead of having a 7-day outbreak, they might have a 5-day outbreak. So the better approach is to suppress the outbreaks totally for someone who has recurrent outbreaks. Someone who has a primary infection and never has another outbreak again, then symptomatic therapy is probably a better approach.